Hi, I'm Melissa Bantug here in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined by Dr. Bob Miller. He's a medical oncologist in the breast cancer program. Dr. Miller, thank you so much for joining us today.
Very happy to be here.
Great, thanks. Can you tell me, do a lot of your patients use the internet to find health information?
Well, I think that's absolutely true these days. I think statistics have shown that probably 60% of all adults in the U.S. are online, and looking up health information online is probably the third most common reason people go online after reading email and doing Google searches. So I think since the mid-1990s, it's pretty much expected that patients are likely to be online, whether they really tell you about that or not in the exam room.
And do you find that this has changed how you practice medicine?
I think it probably did initially, but as I said, it's been going on for so many years now. I think we've just kind of adapted to it. I think it's made it easier in some ways for me to take care of patients because many of them come armed to visits with a lot of good information about what I'm likely to be talking to them about. They've done some research online, and I think that it makes my job almost easier to know that they have done some of the background work that they used to have to rely on the physician or the healthcare team to do. I think sometimes it can be a challenge. It introduces certain challenges. It's easy to find misinformation online, and it can be hard even for someone who's pretty sophisticated at searching to try to understand whether a particular piece of information is relevant to their health condition, whether it's taken out of context or not. So I think the positives outweigh the negatives, though. I'm really happy that patients are doing it.
That's good to hear. Are there websites or places that you would recommend for patients to get started to find reliable health information?
Well, I think there's really quite a few. I think it helps to know what to look for first. I think you have to first look at the type of website. I tell patients that probably the most reliable websites are those that are sponsored by governmental organizations or medical centers or large medical institutions or professional societies. And I usually try to steer my patients to those type of websites first rather than telling them to try to search something on Google because it's a lot harder to be able to filter what you get through a search. I think specific websites that I think are particularly helpful for cancer patients would be cancer.gov, which is the National Cancer Institute. Another is called cancer.net, which is from the American Society of Clinical Oncology, which is a very good source of information. Livestrong.org is another great site, particularly for survivorship care. And just to put in a plug for the Hopkins Kimmel Cancer Center website, I think we have some really good information for our patients there too.
Switching gears a little bit, sometimes we hear from patients that they find it therapeutic or helpful to do blogging. Do you recommend that patients do this, or have you found this to be helpful?
Well, that's a very good question. I think I'm starting to see that. I think that probably more and more of our patients are starting to explore that. I have not observed very many of my patients volunteering to me that they're doing blogging. I think perhaps if they are, they may have some apprehensions about sharing this information with me, but I know there have been some research studies that have looked at this, and it has clearly been shown that this is a great source of comfort for patients, and it really has therapeutic benefit as part of the whole care delivery process. So I really encourage patients who are interested in this way to do this. It just hasn't come up yet in my practice too often.
What about other social media sites, things like Facebook and Twitter? Has that changed how patients look at health information or how caregivers get information?
Oh, absolutely. And I think it's really fascinating what a worldwide cultural phenomenon social media has become in the last 4 or 5 years. It really has touched pretty much all of our lives. I find that many patients find a great deal of comfort in interacting with other patients who have the same condition online. It's so easy these days. For example, everything is pretty much free. You just need internet access, and you can join Twitter and Facebook and blog pretty much without cost. And it's very easy to find other patients like yourself who have the exact same diagnosis, and you can really share with them and you can learn from them. And some people have called this peer-to-peer healthcare, which is, I think, a helpful term. Now, it's not without its risks. It's not without its costs. And I think you have to be aware that not all the information that you get in these sort of social media is going to be valid and it's going to be relevant to you. But I think clearly there is a great untapped potential that our patients, certainly more so than healthcare providers, have figured out a long time ago.
Great. Well, Dr. Miller, this was so helpful. Thank you very much for all that great information.
You're welcome. Glad to be here.
Great. Thank you so much for joining us today.